Bismillahirrahmanirrahim. Assalamu alaikum, respected audience. Today, our topic of discussion is about a very common disease prevalent in children, school-going children, that is lazy eyes. And we will discuss about its examination, its clinical features, and how this disease can be treated. So when we talk about the lazy eyes or amblyopia in the children, it usually happens because of two, three reasons. It may be because of the child not using glasses properly. He may be having any squint, deviation of the eyes outwards, inwards, or he may be having some cataract or some opacity that light cannot pass through the eyeball properly. So these are basically the causes which happen in this amblyopia or lazy eyes. The reason is that in the children the vision is getting developed, and the vision develops in the brain. Eye is just a conducting medium. Light passes, image is formed in retina, but the vision ultimately develops in the brain. So it is very important for the brain to get proper signals from the eyeball. But if the child is in the need of glasses, he cannot see properly, or the one eye is deviated outwards or inwards, the signals, the image which is going up to the brain from that eye is not very clear. So what happens that eye from where the weak signals are going, that side the vision is not developed in the brain. And we know that the age is such, children, everything is growing. Same is the condition with the vision. It also develops in the brain, and when that is not addressed and not properly treated up till the age of 12, 13, we can say, so the vision loss over there, or decreased vision I should say, can become permanent. So it is very important for the children to get examination for their squint, for their eyeglasses done over there. In order to understand this phenomena, why the child develops lazy eyes, it can be understood by this simple example that in children, if their body is developing, and if they, for example, keep on using their one hand, for example right hand, and they do not use the left hand for any activities, writing or anything, or simply we tie up the one hand. So what happens with the passage of time, the right hand will get strength, while the other hand, the left hand, will become weak. So the same is the phenomena happening in the eyes. As I mentioned earlier, the vision develops in the brain. So if, for example, from one eye, the left eye, the child cannot see properly, or the left eye is deviated, or there is a cataract, any media opacity in the cornea or something, so that impulses or the image which is being formed on the retina is not good. So what happens, that the left eye will be weak, but on the other hand the right eye will continue to work. So the right eye will work, and the left eye vision which is being developed in the brain will be suppressed. The same is that condition. So this is a quite common condition in the children we encounter in our clinics. The question is how these things can be addressed in the time, because it is very critical to find out these problems in certain age group. After 12, 13 years, his vision is almost fully developed. Now at this time, if we try to correct this lazy eye phenomena, possible, but not with that much success. So as I mentioned, usually the causes of lazy eye is that children need glasses. I give you an example. He may be needing, he had minus or plus glasses, -6 glasses, and being not used. He may be having difference in another very common is, for example, in one eye he needs -4, and the other eye he needs -2, and he is not using glasses. So -4, which is the weak eye, which is that can develop laziness. Squint, the one eye is deviated outwards, inwards, and the image from, for example, right eye is properly formed in the retina, but the other eye image is not formed properly because it is deviated on one side. So the deviated eye, the squint eye, which is not properly forming image in the retina, which is ultimately transmitted to the brain. So because of that, that can also develop. So these things basically are the causes which I addressed earlier. Correction of the glasses, very important. So how these things can be addressed, how these things can be prevented. First we discussed about the prevention. The prevention, only one thing is that the proper examination of the children, and at least once in a year, and it can happen in the younger age group before the going school age group. So it should be picked up before that one. And once they go into the school health services should be very efficient, and the children vision should be recorded properly. Usually children come to us from the schools when their children notice that child is unable to see on the whiteboard what is written over there, and then we take the children to the doctors for examination. So he is trying to focus, he cannot see properly, and he tried to sit in front of the class over there. So these things basically give us an idea. But its prevention is very easy and important. But at the same time, if the treatment is delayed and the child crosses the age limit of 12, 13 years, it is even difficult to treat at that stage. So very easy to prevent, very easy to treat, provided the child comes in a proper age group, age bracket. So when we talk about the treatment of the lazy eye or amblyopia in the children, it is very simple and straightforward. The child should undergo proper eye examination, and if the child needs glasses, he should be advised, and parents should be also told about the proper compliance. This is very important. For example, if child is using -3 glasses or +2, +3 or +4, he should use it. Number one, so that proper image is formed in the retina, and that image will ultimately be conveyed to the brain, and brain will start working and vision develops over there in the brain cortex. This is the number one thing, very important. The second thing now we are coming towards is, if it is moderate, as I mentioned, up till we do the examination in the clinics, and everybody knows 20/40 to 2100, this is moderate, we can say, moderate lazy eye. But if the child cannot see the line over there on the chart from 2000 to 2400, then it is severe lazy eye or amblyopia. So when we are talking about the moderate lazy eye, moderate amblyopia, in such 2 hours we have to patch or put a cover on the normal eye, so that the child will use the weak eye over there 2 hours daily. But if it is very severe amblyopia or severe lazy eyes, we have to cover the normal or the sound eye for 6 hours daily, so that the weak eye can be used for 6 hours daily for the treatment of severe amblyopia. Very important. And at the same time, once we cover, we apply the patch on the normal eye. In the moderate or severe lazy eye, he has to use his glasses also. He has to use his spectacles. This is very important. By doing this during this age, provided the child is in that age bracket, very important. For example, if a person comes to us 25 years of age or 30 years of age, and he says that I have amblyopia, treatment is not going to be successful, because the vision has already developed, things have happened over there. So in the children, we have to do it depending upon the type, how severe it is, and he has to use the glasses also. The question arises how long it should be done, and then we reach a final stage that the treatment has been done. That is, the treatment should at least be continued for 6 months. Patching of the sound eye with glasses use for at least 6 months to see the success rate and see the recovery, how much is over there. Now, it was earlier considered that while we patch one eye of a child, he should be encouraged to do some near work, he should play with the toys. Now the current studies and research says it doesn't make much difference. Once you cover the normal eye and using the weak eye and using also the glasses, the child can do near work, he can watch television, he can play or whatever. That doesn't make much difference whether he does near work or distant work. So we don't have to make or push the child that he must do near work, writing or something. That is not much difference. So he can do whatever he likes, but the thing is that the weak eye should be put to the use. That is very important. Thing came phenomena about apart from the patching is that dilating drops, for example atropine eye drops available in the markets, and these eye drops by proper dilution are made weak. Yes, usually if we put atropine eye drop, the child will not be able to, pupil will be dilated and it will dilate the pupil for 2 weeks. So it is diluted and made weak atropine eye drops, and this can be used in the older children under proper medical supervision and under proper medical care. Yes, in older children, atropine diluted eye drops can be used in the normal eye. So that, for example, if the left eye is the weak one, they put these diluted weak atropine eye drops in the normal eye. Now the child is forced, especially the older one, are forced to use the weak eye for their daily activities. So, but this should always be done under proper medical supervision. Yes, and some people use it these drops daily, while also these are being used on the weekends. It depends about how it is used by proper certified medical physician or a pediatric ophthalmologist or doctors who are dealing with this. So it depends how they are going to prescribe. But this is one of the possible treatments, and we call it atropinization, or we're putting the dilating atropine drops in the normal eye so that the other eye is put to use. Patching is the time-tested treatment with glasses, very effective if done properly, and it needs a compliance. Of course, the child is not going to see with the lazy eye. He will throw the glasses. He will not be very cooperative in the beginning, but it is the job of the parents to encourage the child to use these patching. Apart from this, filters can also be used, available under proper medical care, covering the sound eye and applying on the glasses so that the weak eye can be used. So this is another way. As I mentioned, amblyopia, the most common cause is that child is not using glasses. He may be having -6, -4, both eyes. Other possibility is, which is very common also, that vision, for example, in one eye is -2 and the other eye is -6. So there is difference between two eyes of -4. So this difference, which we call anisometropia, different prescription in two eyes, it's also very common. And amblyopia usually affects one eye. That's why we call it lazy eye. But this does not mean that it always happens. No, it can cause lazy eyes in both eyes. For example, child is -6 +4 and he is not using. Very much possible that he can develop lazy eyes in both eyes, but usually one eye. So that is very important. Earlier we talked about the squint. Earlier it was thought that first should be lazy eye treatment should be done, and then the child can go for squint treatment or surgery. But nowadays people feel that the squint surgery should be done earlier. The eyes should be straightened, properly aligned, so that the image from the both eyes goes over there and properly formed on the retina. So squint surgery can be done earlier by the proper medical pediatric ophthalmologists, the surgeons, squint surgeons who are dealing it. And once the eyes aligned, the treatment can be continued along with it. So up till now we have discussed about patching, glasses, diluted weak atropine eye drops, and role of the squint surgery. But in spite of all these things, we have seen that we treated the amblyopia and it happened again. And it goes up to sometimes 25%. So the thing is that even after the treatment, we have to keep an eye on the children's vision, and he should be properly followed up. And if it happens, we have to start again our treatment of amblyopia, which I mentioned, 6 hours per day. And once things come under control, it can be decreased to 2 hours per day. Very important, whenever we are treating lazy eyes, 6 months we did treatment, it was successful. The treatment must not be stopped immediately. No, it should be gradually tapered off. Number of hours should be decreased, and gradually it should be stopped the treatment. So recurrence, number one, is very important, and the disease can come back. So once come back, so we need a regular follow-up, and once comes, we have to treat it again. And number two, very important thing is that it should not be stopped immediately. Whenever we are treating anybody first time or recurrence, the treatment should be gradually tapered off. That is very important. So now I come towards the last point, part of my presentation, and that is depth perception or 3D imaging. Anybody who uses his two eyes, he can appreciate depth perception or 3D. That is, simple words, I can say that I am sitting in front of you and the wall is behind me. This you can appreciate only if you are using both eyes. If one eye is being used, this depth perception phenomena cannot be enjoyed. Yes. So this same thing happens in these amblyopia children, because one eye is lazy, one eye is not being used, the other eye gets stronger and takes vision. So they cannot appreciate things. Apart from decreased vision in one eye, they also suffer this phenomena, depth perception, that can only be achieved by using both eyes. Single eye, if you look at me, you will see that I'm just along with the wall. But if you use both eyes, then you can appreciate the near and far things. Yes, this is depth perception. So this also phenomena happens in the children who has got lazy eyes. We know this is an era of digitalization, digital media. So many digital devices have been also brought in the market, which encourage child to use as a treatment for amblyopia and also for the depth perception. So basically this amblyopia is quite common, quite prevalent, and it should always be kept in the back of the mind when we are examining, or if a child is complaining in school that I cannot see on the whiteboard. Immediately these things should be addressed. Very easy to treat, I mentioned, if the child comes in the proper age group. But if the child comes after 14, 15 years of age, they have even got some success rates. Studies have been done, but the treatment is not that much promising, because in the earlier age, a whole body is developing, so it is very easy for us to do so many things and correct the loss over there. And even in school, health services should be encouraged to include proper eye examination. And even before that, if a child is not going to the school, even then the parents should keep in the mind that eye examination is very important. I want to thank my respected audience for their attendance and attention. I hope my today's presentation about this lazy eyes or amblyopia, quite common disease, will be beneficial in their clinical practice and also to our audience who are not related to the medical field. I want to thank you. Thanks.